Well, Italy is seeing a decrease in the rate of new confirmed COVID-19 cases while registering a record number of people cured.
To get down from the numbers, not just stabilise, requires a redoubling of public health efforts to push down. It won't go down by itself. It will be pushed down. And that's what we need countries to focus on.
According to the World Health Organization, it is not the time to lighten up tough measures to limit and track the spread of the virus. Italy is currently the country with the most deaths due to the pandemic, with over 11,000 people. Today, Italy and the Holy See flew flags at half-staff in honor of those who have died from the coronavirus. Dr. Marta Ciofi, head of the epidemiology clinic at the Vatican's Bambino Gesu Children's Hospital, joins us now from Rome. Thank you so much for joining us, Doctor.
Thank you. Good evening.
Well, I know that doctors and hospitals, as well as other healthcare workers, are doing all they can to care for and also stabilize the patients that are infected with COVID-19. But what about the nurses and doctors? How are they coping physically and emotionally? It must be really hard.
Yes, for sure. It's a period of extreme stress for healthcare workers. So there are a set of things that we have to do to cope to this pandemic. And first of all, we have to find the time to sleep, to eat, to drink. So it is very important to organize shifts in a way that we have enough time for breaks. And second, it's important to share our feeling and anxiety with family, friends, and loved ones, to share this very unusual experience. And third, we have to be very strict regarding procedure for infection prevention and control, to be safe and to have our family safe and people around us safe. And this is very important in terms of training and maintaining control.
Have we learned anything new about the virus in recent weeks? Anything that may help to stop spreading it?
We know that this virus is transmitted by droplet and contact. The very important thing is that we are all susceptible to this new virus, so this is why it can spread so rapidly and widely. Since we do not have any vaccine yet, we have to adopt these non-pharmaceutical measures such as anti-hygiene, personal protective equipment, and prompt isolation of suspected patients and their contacts. And this is why there is so much work on having new tools for fast identification of patients, such as virological testing that can give us results in a very short time, in 1 hour just. But this is very important to have dedicated ways of suspected patient to enter into the hospital and to be tracked, isolated, and maintaining isolation during their in-hospital stay.
Doctor, do you think the pandemic will change the way the hospital procedures, how hospitals operate in the future?
Yes, I think that we are learning a lot from this experience, and for sure, preparedness to emergent infectious disease will be enforced, has been enforced strengthened by this experience, and also tools such as telemedicine or artificial intelligence are even more important in this setting. Particularly telemedicine is very important now, since there is a reduction of access to hospitals, and we can take care of patients, for example, with chronic conditions, using tools for visiting them and treating them by a distance. And for sure, this will be maintained and reinforced in the future.
Well, Doctor, thank you so much for your time and your insight. We really appreciate it. Dr. Marta Ciofi, the head of epidemiology clinic at the Bambino Gesu Children's Hospital in Rome. Thank you.
Thank you.